Doctors stress early detection saves lives for cancer patients, but they also say even when women do the right thing, mammograms can sometimes miss their breast cancer. It's got the attention of health officials nationwide. We dug deeper into the FDA's plan to update the guidelines and how it could change the screening process.
For many, the key to beating breast cancer is early detection. 48-year-old Eve Feinberg gets a mammogram every year.
My two paternal aunts were diagnosed with breast cancer. I have always lived with this fear that I too will die of breast cancer.
Her physician, Dr. Sarah Friedwald, says Feinberg is also at a slightly higher risk because her breasts are dense, meaning they have less fat and more tissue, like the breasts in these images.
About 40 to 50% of the women in the country actually have dense breast tissue. It just makes it a little bit harder for us to find cancer on the mammogram.
That's because dense tissue shows up white on mammograms, and so do tumors.
On a very cloudy day, which would be similar to a woman who has very dense breast tissue, we really can't see the cancer.
She showed us how, for this patient, additional scans, an ultrasound and an MRI revealed a large cancerous mass.
The area lights up very quickly.
38 states now require patients to be notified about their breast density, and the FDA is planning to announce regulations on informing women about their tissue type and screening options. Patients should ask their doctor about their tissue type, and if additional tests are needed, make sure to get a medical order and check if their insurance company requires pre-approval and covers the cost, ranging from a few hundred to thousands of dollars. Feinberg told us she pays around $2,000 out of pocket each year for an MRI after insurance coverage. But she says it's worth it.
I think just to know that if something is detected, it will be detected at an early stage.
Only 16 states and Washington, D.C. require insurers to cover additional imaging. If breast cancer is caught early, the 5-year survival rate is 99%. Healthcare providers work to keep updating screening practices and technology. Atrium Health Wake Forest Baptist began using something called contrast-enhanced mammography. The imaging technique uses iodinated IV contrast in combination with a standard digital mammogram. That technology then provides mammography images with better precision than a standard mammogram. Doctors say it's especially useful for patients with dense breast tissue.
If there's questions that come up on a standard mammogram, or also if you have a slightly increased risk of breast cancer and you have heterogeneously or extremely dense breast tissue. And if you don't know, if you haven't looked at a mammogram, dense tissue is basically the normal glandular tissue that shows up as white on a mammogram. And breast cancers also show up as white on a mammogram. So sometimes that dense breast tissue can hide tumors.
The Comprehensive Cancer Center at the hospital is the first in the region to offer this technology to patients. Well, doctors want to keep learning more about who is most at risk. Right now, they know for sure it has a lot to do with your family tree. Some places like Novant Health offer genetic testing, so you can learn more if you didn't already know.
We recommend anybody that has a suspicious family history or suspicious personal history. Is there a strong history of similar types of cancer in the family? Are there lots of women with breast cancer? Are there lots of women with ovarian cancer? Lots of men with prostate cancer?
So if a patient receives a positive test result, their physician may suggest several proactive treatment options like enhanced screening. Family history, of course, just one risk factor to consider. Doctors are still trying to figure out who's most at risk for the disease. Now, our Verified team says, again, the answer isn't only in your genes.
October is a month dedicated to learning more about a disease we're well aware of. Chances are you know someone who's had it, maybe even in your own family. Doctors and researchers are putting these connections to work in the fight against breast cancer. Let's verify, how is breast cancer passed down? We turn to two doctors, the CDC and the American Cancer Society. Like other medical conditions, Dr. Claudine Isaacs says breast cancer can run in the family.
So it's really important for women to know if they have a strong family history or they have something going on.
The CDC says chances of breast cancer are higher in someone whose mother, sister, or daughter, or multiple family members on either parent's side of the family has had breast or ovarian cancer. The American Cancer Society describes a variety of reasons why breast cancer may be more common in some families, including genetics.
About a third of women who develop breast cancer have a family history, but only about 10% have a hereditary predisposition.
You may have heard of BRCA gene mutations indicating higher likelihood of breast and other cancers. Dr. Kala Viswanathan says medical professionals can now look at a whole panel of genetic information connected to breast cancer risk.
We then divide those genes into those that are at higher risk versus moderate versus.
Genetic testing is usually done with a blood draw or cheek swab. Some at-home DNA tests you can buy yourself are FDA approved for detecting genetic variants like in the BRCA genes. But Dr. Viswanathan says they are not comprehensive or a substitute for a conversation with your doctor.
If you're just intrigued or interested, go ahead, but I wouldn't use it as a health, to sort of direct your health care.
Screening and preventative action is often encouraged earlier or more frequently for people with family history, and those with additional genetic risk factors might also have more intensive medical prevention options available.
How do we work with you to put these strategies into place?
Well, doctors recommend women between 50 and 74 get screened every 2 years if they're in good health. Women may need to get screened earlier if they have other risk factors in play. A UNC group recently studied mammography accuracy, and it revealed racial and ethnic disparities. Researchers found the rate of diagnostic accuracy highest in non-Hispanic white women and lowest in Hispanic women. The UNC team said the disparity in accuracy might be due to the quality of equipment used and the skill of the technicians operating it. Researchers said none of the screenings fell below minimal acceptable standards. Now, all the advances that we've seen in technology and research have led to outcomes for women like Maria Hicks. She got diagnosed with breast cancer several years ago, and she beat the disease and rang the bell. Now, this led Hicks to start her new nonprofit called Shiro Collaboration. She's raising money for Cone Health's Cancer Center and bringing awareness to the importance of early detection.
Very traumatic because I was also caregiving for my terminally ill dad at the time. So it was a lot. October of 2019. I rang the bell, but I never stopped ringing the bell because now I'm ringing it for other people and making sure the awareness is there and making sure they have the support that they need.
Hicks' cancer was small. Doctors told her there was no way that she would have felt it unless she would have had the screening. She urges all women to stay on schedule with their screenings and have regular conversations with their doctor. Well, Breast Cancer Awareness Month is October, right? But due to Hurricane Ian, one of the biggest awareness events is stretching into November. The Cone Health Women's Only 5K is rescheduled for November 6th. That is a Sunday afternoon. The event raises funds for the mammography scholarship so all women can get screened. You can still sign up on our website